Hi, Dr. Timothy Harcourt from Coast Chiropractic Centers in the beautiful Fort Myers, Florida. Today we're going to talk about neck injury. We see a lot of patients in the practice that have had neck injuries, and there's a lot of reasons they could have a neck injury. Of course, one reason you think of is a car accident, a whiplash, could be a typical whiplash or a lateral whiplash. Sports injuries certainly can cause head injuries. Soccer, football, all those kind of things can cause neck injury. Boating accidents can cause injury, and there's several other reasons for neck injury but are less common. Now, the symptoms that we see with somebody that has a neck injury include, of course, neck and back pain, dizziness, nausea, shoulder and arm pain, and or numbness, headache, difficulty sleeping, feeling like the head will fall off without support, and foggy head, which is a feeling of disorientation or feeling as though you're not in the present time. There's a loss of present time consciousness, or just feeling disconnected. Now, what is the best course of action of feeling symptoms of neck injury? First thing is to get a thorough history and examination so that your doctor can determine the extent of injury and which tissues are affected, whether it be muscle, ligament, disc, nerve, bone, or a combination of the above. Your doctor will then determine whether or not you need imaging studies such as X-ray, MRI, or CT to evaluate the structural integrity of the neck. Please be advised, however, that X-ray, MRI, and CT can show structural change in your body, such as a broken bone, a herniated disc, or a tumor. They are extremely poor and not designed for identifying functional problems of the neck, such as restricted or stuck joints, abnormally tender muscles, and pinched nerves. The reality is, for most neck injuries, they are functional problems, and an MRI, CT, and X-ray is not very good to identify those particular problems, nor to track their improvement. Now the question remains, what should you do if you've had a thorough history examination and imaging studies like X-ray, MRI, and or CT scans, and your symptoms are persistent or worsening with little hope in sight? The definition of insanity is doing the same thing and expecting a different result. One thing you might want to consider would be to get specific functional testing that evaluates functional deficit with periodic percent improvement testing to ensure your proper recovery. If your function is not being measured, it cannot be tracked. Your tracking improvement over time helps to ensure a maximal recovery from your condition in the shortest time period. You can find out more about how Coast Chiropractic Centers Incorporated track patient improvement over time by clicking on the Sonoma Method tab on our website, by scanning the QR code at the end of this video, or by typing in www.coastchirocenter.com. Should you have an interest in getting over your neck injury through a university-tested functional testing method, give us a call at Coast Chiropractic Centers Incorporated in Fort Myers, Florida at 239-278-3344. We would love to see you here as a patient.
Hi, I'm Danny Janczewski, Office Manager of Coast Chiropractic Centers. I want to thank you for watching this informational video by Dr. B. Timothy Harcourt, Board Certified Chiropractic Orthopedist, and the inventor and copywriter of the Sonoma Method. Take care. We'll see you next time.